I am I'm Megan Shelton. My pronouns are she, her, hers, and I'm currently serving as the interim division director at the Behavioral Health Administration. Angelina, thank you for the overview of the ASL interpretation. So I will go ahead and move on to the next slide, give you all a moment to read through this. You can spotlight your ASL interpreters so they appear larger on your screen, and you have the ability to change your view at any time. Closed captioning has been enabled for this event. Click on the closed captioning button at the bottom of your Zoom to turn on subtitles. If you need to change the language for subtitles, click the caret at the right of the bottom of the button and choose your preferred language. If you are having technical difficulties, please direct message Angelina Callis in the chat for help. So I am excited about our agenda today. We will start with the purpose and intended outcomes of the meeting. We'll talk about how you can get involved and engaged with the BHA. And then we have some guest presenters from the Health Information Technology team to present on some BHA updates that are going on. And we have a panel of subject matter experts that are here to address some of your questions as follow-up from the February Town Hall. And then I'm very excited about our panel on BHA rule, and we have made plenty of time for question and answers. And that is it. So we will start with a poll. On the next slide, there will be some bodies of water, and we just want you to select which one brings you the most peace today. All right, it looks like we have a pretty clear tie. I can't tell if it's a tie or if there's a window. It looks like there might be a tie for number 2, which is very peaceful scene as they all are, but very close was number 1, which is a scene from our own state of Colorado. Thank you all for participating. So just to review, the purpose of the town hall is so that stakeholders have an ongoing opportunity to learn directly from the BHA leadership and staff about important updates and progress. You will receive high-level information from the BHA and also information on how to engage with the BHA. With the BHA in future for more information, and a reminder that town halls do not take the place of targeted stakeholder engagement opportunities where we ask for input or feedback on specific approaches. All sessions are open to the public, and we welcome your feedback on future session topics. So this next slide contains some ways that you can get involved with the BHA. You can subscribe to the BHA's monthly newsletter. There's a feedback form on the BHA website. And then there's the BHA calendar that is open to the public, and that contains the schedule for monthly provider and crisis convening, the monthly BHA town halls, the BHA advisory council meetings, and the Behavioral Health Planning and Advisory Council. I am now excited to present our Health Information Technology team. So I will pass it over to Alex and Tristan. Alex and Tristan, please introduce yourselves, and we're excited to hear what you have to share.
Hello, everyone. Thank you so much. My name is Tristan Vanek. I use he, him pronouns, and I am a product manager with the BHA, here with my design partner, Alex Orlov, to give you an overview and demo of OwnPath. And OwnPath is a website that allows you to find mental health and substance use disorder providers that are licensed by the BHA. If you could go to the next slide. So, oh, yep, that one. OwnPath allows you to either quickly pop in your zip code or go through a guided search and find providers who are in your area, as well as those who offer telehealth. It was launched last July to support the BHA's vision of making behavioral health services accessible, meaningful, and trusted. And we like to say that OwnPath is the front door to all people of Colorado to engage with the BHA. And in that vein, we really want to ground our work in human-centered design and are committed to co-creation with the people of Colorado. You can access OwnPath on your computer or on your phone at ownpath.co. It's available in English and Spanish, and it supports screen readers. Since launch, it has attracted 150,000 people to visit the site, and we're continually iterating and improving the service. Currently working to expand the range of providers and the number of languages the site's offered in. So we always welcome your feedback, and Alex is about to show you how to give that feedback through a survey, and we promise we do look at every survey response. So Alex, please take it away for the live demo.
Thank you so much, Tristan. Hello, everyone. My name is Alex Orlov, and my pronouns are she, her, and I am a human-centered designer working on OwnPath. What I'm going to do now is share my screen. Unfortunately, it looks like I am unable to share my screen. Oh. Megan, would you mind? All right, let's see. Here. Okay. Megan, can you give me a thumbs up if you can see my screen? All right, I got a thumbs up from folks, so it looks like the sharing is successful. So what you're looking at right now is OwnPath on a desktop computer. This is the homepage. And as Tristan mentioned, there are a few ways you can find a provider. You can plug in your zip code and indicate what type of provider, what type of treatment you are looking for. You can also do a guided search, which is this teal area below. Once I hit search, I can see a map of providers that might be in my zip code, and I can explore other information about this provider, such as payment types, hours of operation, services, accessibility, languages spoken, and populations served. One thing we are especially excited about that is new is we now have an ability for visitors to OwnPath to filter on different populations served, and we're hoping to improve this filter even more in the months to come. I also wanted to call out how you can provide feedback on the OwnPath website. There is a survey that you can take by clicking this button on the bottom right-hand side of the screen. You can also scroll all the way down to the bottom of the screen and click the OwnPath survey link in the purple area at the very bottom. As Tristan mentioned, we do take a look at every single response, and we look forward to hearing about your experience. I'm seeing a few questions in the chat. Is it all right if I take a look at those?
Yeah, I'm going to jump in just quickly. So for folks, we have two ASL interpreters on. The one who is running right now, their name says Maureen Mecheco. So if you are having trouble pinning the right person, please, while we have a minute and we're not sharing screens, jump in and make sure that you're pinning the right interpreter, and we will try to make sure that that's working.
Thank you, Angelina. I will hold off for just a minute on sharing.
And Alex, you're welcome to, there were a couple of questions if you want to do maybe, what do we have time for, Megan? One, maybe two questions?
I think so. I think we can try two if they're quick.
Okay, so the first one Kelly had asked, I noticed OwnPath does not have ability to choose type of services such as IOP, inpatient, groups, etc.
Great question, Kelly. We are currently working on expanding the number of providers that we have on OwnPath, as well as the information we have about those providers. And so we are hoping that in the future, we will have the ability to choose different types of services. It's definitely on our wish list of things to add to OwnPath.
Okay, and there were two other questions, but I want to note for folks, because we want to have enough time for the panel discussion, we'll probably move on. Tristan did put the link in the chat to the OwnPath feedback survey, and we will make sure that that is included in the slide deck when we post it online.
Thank you, Angelina. All right, next up, we will address your questions. These are questions that came up during the February town hall that we did not have time to answer during that meeting. And we have some really great subject matter experts here today from the BHA that will answer those questions for you. So first up is, how will the crisis resolution team be working with other efforts, for example, the collaborative management program? So I will pass it over to Chris Meyer. Chris, if you want to introduce yourself and answer that question.
Hello and good afternoon. My name is Chris Meyer and I go by she, her, hers, and I am the Senior Advisor for Children, Youth, and Families here at the BHA. This is a great question about our crisis resolution teams and the collaborative management programs, which are local programs supporting children, youth, and families 0 to 21 that are often served by multiple systems. And so our response is the crisis resolution teams can work with local efforts such as collaborative management programs to refer a child or youth to get support with coordinated services within that local or county collaborative management program. The other opportunity is that collaborative management programs who are working with children, youth, and families could also refer to a local crisis resolution team or regional crisis resolution team to be able to support a family that would benefit from crisis stabilization services. That is it. Thank you, Megan.
Thank you so much, Chris. Next question was, super interested in knowing how many beds will be added to the state for adult and adolescent admits. And I will pass that to Stephanie Bush.
Thank you, Megan, and hello all. My name is Stephanie Bush. Pronouns are she, her, hers. I'm the media manager here at the BHA. And what we can tell you today is that there will be 16 additional youth substance use disorder beds that will be anticipated to be available on July 1st. These 16 beds will be housed at Jefferson Hills, and there will be a withdrawal management services available through Denver Health as well.
Thank you, Stephanie.
Today. Thank you, Megan.
Thank you, Stephanie. The next question is, anything being done to stabilize the workforce and the funding for safety net providers? So I will pass that to Wendy Zimmerman.
Hello, everyone. I'm Wendy Zimmerman. I'm the Director of Workforce Development for the BHA, and I believe we have a slide that, hold on. Yes, we do have a slide. Perfect, thank you. This is an update in the spirit of transparency on current grant programs that are out that people are interested in. I will just remind you that if a grant is open right now, then I can't answer direct questions about it. The questions need to go through the VSS site for the state. We have completed our first round of applications for the SUD workforce retention grants, and also for the recruitment and retention grants. So we should be announcing awardees soon. And then we anticipate having career pipeline grants and peer support grants open by June 30th. If you are familiar at all with our workforce strategic plan that came out on September 1st, you'll recognize that this is only speaking to grants. There are many other initiatives that are currently in progress around building up and strengthening the workforce, but these ones that specifically put money out to all of you to support the work you're doing, this is the update.
Thank you, Wendy. And our fourth and final question for today is in regards to the BASOs. And specifically, the question was, does leadership have a timeline for the BASO region approach? And so I will pass that over to Stephen Pang.
Thank you, Megan. Good afternoon, everyone. My name is Stephen Pang. My pronouns are he, him, his, and I am the Chief Financial Officer for the BHA. And so for this question, we are continuing to take into account all of the feedback that we've received around our kind of BASO region considerations. And so we're still looking at that feedback, the data, and ultimately refining our decisions here around BASO so that we can have a comprehensive invitation to negotiate like we've previously discussed. Included in kind of the refinement of decisions in the BASOs are specifically also the number of regions. So we are continuing to work through that, and we'll be releasing that information before we release the ITN, or the invitation to negotiate, which is tentatively scheduled for around early to mid-May.
Thank you, Stephen. Okay, next up is our rule presentation and our panel, and that will be followed by question and answers. And so I am excited to introduce Andrea Jones, Victoria Lasky, and Mel Tyler. I will let you all introduce yourselves and then let me know when you're ready for me to present the next slide.
Sure, I will go ahead and jump in. I think I'm up. My name is Andrea Jones. My pronouns are she, her. I am the Deputy Policy Director at the BHA. I also have a tendency to speak very quickly, so I'm going to consciously try to slow myself down here a little bit. And I will give you a sort of broader overview of what the rules are in general. And then we have some of our safety net licensing team here to talk a little bit more specifically about provider rules. So we can go to the next slide.
Awesome. Before we jump into that, Megan, can you stop sharing for just a minute? We're still having some issues with the ASL interpreter. So Megan, can you go to your videos and pin the interpreter, please? So if you right click on their video, should be a little option in that list that says pin. I apologize, folks. We're trying to, something's wrong with our view settings. So we're going to see if we can get it fixed. Okay, now try to share again, and then let's see if that works. I appreciate your patience.
Thank you, Angelina. Thank you for bringing that to my attention. Okay, did that work? Are you still able to see the interpreter?
We might have to wait a minute and see. I know when we get to the actual panelist discussion, we're just going to open it up and we'll stop sharing screens, right? So that will be helpful too.
Yes.
Okay.
So I shared my screen and then I didn't know, does the ASL interpreter, can you see him on my screen? Can
Looks
you
like
see it on what I
in
shared?
it looks like in the chat it did not work.
Oh, it did not work. Okay.
Excuse me, suggest select view at the top right of your screen and side-by-side speaker, and you will be able to see the ASL interpreter clearly.
We'll keep working on it, Megan. You folks go ahead. Thank you.
Thank you, Angelina.
Awesome. Okay, let me orient myself here. All right, so just at a very high level, I want to make a differentiation for everyone between statutes versus rules, right? So statutes are enacted by the General Assembly. These are our laws that go into the Colorado Revised Statutes, and regulations or rules. So a rule set is made up of individual regulations, right? That's the differentiation there. Are basically, they clarify the intent of the laws that are enacted by the General Assembly, which we have no control over as an administration, but we do get to help walk out how those things play out in reality, right? So the statutes are sort of the ideas and the rules are how they're actually implemented on the ground. The BHA itself promulgates a couple different types of rules. We call them sets, or they're different topically or categorically. So we have administrative rules, which is sort of how the system functions as a whole and how both state agencies and providers interact with each other. And how they interact with the behavioral health system across Colorado. We have commissioner or executive director rules, which are really more focused on internal systems, personnel administration, things that we need to keep our administration functioning. And then we have the provider rules, which I think is the majority of what the interest is in, which is why we will have Victoria and Mel talking about the provider rules with a little more specificity in just a moment. Let's see, did I miss anything there? Okay, and then the other differentiation I wanted to make for everyone is, we get a question a lot, how can I get involved in rules? How can I comment on legislation that is going? And as just noted, those are separate things, right? So we have the rule feedback email address, which is a great way to get information in front of us, things you're concerned about with our rules. And we can see them in writing, respond in writing. That's always very helpful. If you have a question or an idea surrounding legislation that is currently moving forward, we ask that you would reach out to our legislative affairs officer, Casey Badmington, and her information is on the screen as well. So I'm just trying to orient everybody in legislation versus rules, because we're in that fun time where both things are happening simultaneously. So I will turn it over to our safety net team to kind of give some more specifics on where we're at with our provider rules at the moment.
Thank you, Andrea.
Thank you. Good afternoon, everyone. My name is Victoria Lasky. I am the Associate Director of Safety Net Licensing at the Behavioral Health Administration, which is a division within our Quality and Standards Division. And my pronouns are she, her. And I've been leading the rewrite of the BHA licensing rules along with my Safety Net team. And I'll also pause and let Mel introduce herself now too.
Thanks, Victoria. Hi, everybody. Good afternoon. I'm Mel Tyler, she, her pronouns, and I am a safety net licensing manager. I primarily drafted chapters 5, 7, 8, 15, and co-drafted 16. And I'm excited to talk about rules a little more with you today.
Thank you both for joining us.
Thank you. So Andrea teed us up very nicely with a very high level view of what are rules, what is statute. And then she promised we'd go into more detail about the provider rules, which Mel and I will be doing for the next few minutes. So provider rules are a set of license requirements that behavioral health providers need to meet in order to get a license and provide services. So that means that if there is a behavioral health provider in the state of Colorado that wants to be licensed, they need to take a look at the set of rules that deal with things like health, safety, and welfare of individuals being served. So are these services provided in a safe setting? Are individuals given the rights that they deserve regarding their treatment? Are these treatment services high quality? And the rules really speak to all of those pieces to ensure that providers are providing the highest quality of care to Coloradans. And so the BHA's role in provider rule development is that we are writing or drafting the rules based on existing regulations. So that includes our existing regulations, as well as the Department of Public Health and Environment's existing regulations for behavioral health entities, requirements that are set forth in law or in statute, as Andrea explained the difference. If a law says that this needs to be in rule, then that will be in rule. Best practices, and then I really want to highlight this last piece of stakeholder input. So the intention is really for these rules to be co-created with the people of Colorado. And in that, we have held a series of town halls through December and January. I recognize a number of familiar names on the call today who joined us in those. We received over 600 written public comments on the rules, and we integrated that feedback, which we then presented at the rule replay on February 15th. So really wanted to highlight that stakeholder input part of this process of drafting. The BHA presents the rules to the State Board of Human Services, and the State Board of Human Services ultimately decides whether or not to adopt these rules, which changes may need to be made to adopt these rules in order for them to be fully effective. And now I'll pass it over to Mel.
Great, thanks, Victoria. Hello again, everybody. So I'm going to talk to you about what the impact means of these rules on people and communities of Colorado. So current state of our behavioral health system in Colorado can be really frustrating and confusing for both those providing the services and for those accessing or trying to access the services in Colorado, because it's a split system. Split in that you have one state department that regulates substance use disorder agencies with their own rules and licensing standards. And then you have another separate state department that oversees mental health treatment agencies with separate regulations and licensing standards. So what we're trying to do with these rule changes is streamline the licensing and regulation process by requiring agencies that provide behavioral health services, and that's both mental health and substance use disorder treatment, to be under the same base license and regulated by one agency, and that's with the BHA. But why does all of this matter? Well, remember that frustrating and confusing system? I'm going to say a fact that Some of you may have already heard, it still is upsetting. I think at least it is to me. And that is that, did you know that last year, Colorado was ranked last in the country for adult behavioral health care? That makes me angry. I don't know about you, but that really upsets me. But updating the rules is a step in the direction of making our behavioral healthcare system better, because we matter. Our behavioral health matters, and we deserve better than being last. So these rules matter because they support individuals. They support our kids, our parents, our friends, to find easier access to having behavioral health needs met, and ensuring that that treatment that's being received is at the same standard of high quality services across Colorado's licensed provider network. So these rules do matter. And I am going to hand it back over to Megan to moderate questions.
Wow, thank you both for such a great presentation on rules. I feel like I learned something today as well. So I will pass it over to Angelina to see what we have in the chat.
Okay, so there's lots of posting links and emails for folks. We'll make sure that those are linked in the PowerPoint when we post it as well, of course. And I hope folks are all right. I'm going to leave my video off because for right now, that seems to be the only way we can keep our ASL interpreter on the screen. So we will figure this out with Zoom, and I promise by the next town hall, it will be much easier. Okay, there were some specific questions that were asked in the Q&A, but it looks like folks have already responded to those. So let me roll through and see, and it's open up for questions. Attendees, you're welcome to raise your hand or put specific questions for our panelists in the chat. So I'm going to give just a minute for folks to decide if they'd like to come off and ask questions as well.
And Angelina, I'm going to stop sharing for a minute and see if that helps with the interpreters.
There we go. I can spotlight the interpreter for everybody. Okay. So I'm going to read a couple of the responses or the questions that came up in the Q&A as folks decide. Again, if you want to use the raise your hand function in Zoom, then we're happy to let you come off mute and ask your question. You also can put things in the chat. So, and I apologize if this is out of order because I think our Q&A tracks based on when your question got responded to. But someone did ask, I understand that the effective date for the new rules is 7/1/23. For providers who want to begin working to update policies, can you offer any guidance on whether this may be possible before 7/1 or June 1st, i.e. rules finalized and just waiting for the 7/1/23 effective date, or if we just need to wait until July 1st? Thank you. And then Dr. Medlock responded, we will be releasing a public memo to update the people of Colorado on the 3-month delayed timeline we are hoping to execute. So at 10/1 effective date with additional time for providers to adjust to the new standards. And then Tasha asked a question in the chat. Where can Coloradians access the rules for all departments throughout the state? And how are the rules being enforced throughout the state? So there was a response here, but I'm hoping a kind of more general response. I'm hoping our panelists can maybe talk specifically around how one would access the BHA rules and a little bit more about how those are enforced.
Sure. So I can go ahead and put the link specifically to the BHA's rule website, our page on our website that deals with our rules, into the chat. And then, as I noted in the chat, this is kind of the same across state departments. You can usually find this information on an agency's website. As far as how the BHA enforces its rules administratively, it's going to depend on what kind of rule we're talking about. I know everybody loves the answer of it depends. However, in this case, that's really the truth of it. If we're talking about licensing rules, that's one thing, or administrative rules. Sort of those enforcement mechanisms are broken out depending on what category of rules you're talking about. And I'm happy to answer that in some more specificity for you. If there's still confusion around there, please feel free to reach out to us and I can help navigate you where you need to be on our rules page. So.
I'll also add that the rules are accessible on the Secretary of State webpage. We can post the link to our current rules if that's helpful, but we also, you may see in the chat that Mel posted the link to the Secretary of State with our most current version of our rules. The rules on the BHA webpage, we are in the process of updating to make sure that's the latest language. And you can also access that on the Secretary of State webpage.
So we did get a question in the chat. Is the 10-1 going to be the effective date for subsequent M1 holds to be written, or does that remain July 1st? And then we did have a response. 10-1 refers to behavioral health entity rules, not 27-65 rules. I know that was already kind of a question and response, but can our panelists maybe give us some background on what all of these numbers mean?
Hi, Angelina. Hi, everybody. Good to see you. Morgan Metlock, she, her, hers, Commissioner of the Behavioral Health Administration. I want to be sure that we are giving what I'm putting in the chat the moment that it deserves in terms of, I'm sure this is big news for the folks on the line to hear that behavioral health entity rules will not be pushing forward on that prior aggressive timeline that was in the Behavioral Health Administration bill. So as you know, we all got a big shock when we realized that we had just a few months to rewrite rules and standards for the entire continuum of services by July 1 of this year. So we have heard the feedback that we need to slow down. And so what I was saying in the chat is that we have to pursue a statutory change this legislative session to provide an additional 3 months for those rules to be effective October 1 instead of July 1. But I want to be clear that that is different than the question of M1 holds and any changes to 2765, which refers to our involuntary treatment approaches. I see Victoria Lasky is on the line. We are talking about, when I say 3-month delay, we're talking about those chapters that pertain to the larger entities across the state called behavioral health entities. And I think this particular question is bringing in another separate issue. So Victoria, can you help me clarify that piece?
Yes, so this is regarding the timelines in House Bill 22-1256 and the various changes that we have there. So we are, that delay is pertaining specifically to the behavioral health entity rules, as Dr. Medlock mentioned, and we will have additional rule chapters going forward that speak to the changes to involuntary treatment. We are currently working on finalizing the timeline for those chapters that pertain to those specific changes to involuntary treatment. So more information will be available soon.
Thank you for that, Dr. Medlock. Angelina, do we have more questions?
Yes, so we did get one in the Q&A. How and when will we be able to apply for new licenses or updated licenses?
So thank you for that question. This is largely related to that question about the rule timeline delay, because until we have those new rules effective, we don't have the authority to grant those licenses. So as Dr. Medlock said, what we are anticipating at this time is that we would have those rules effective for October 1st. And after that, our licensing system will be able to accept applications for this new license type. We are planning provider trainings and technical assistance to get more into that how piece. And so you will get more information about that soon, but that is, again, waiting for that memo, but we are expecting that October 1st to be the when.
Great, thank you so much. There's a question about the link you put in the chat, Victoria. Not sure if you saw it. Is this the last link? Oh, sorry, is this last link the current rules, or will they still be updated?
Yes, thank you. I can clarify that. I realize we've got links on links. So this, what I posted in the chat, just for clarity, is our current rules that are effective as of July 1st, 2022. So these are our current provider rules. These are not the updated rules that we are working on promulgating at this time, but just wanted to provide that as a point of reference for what are the current rules. For the updated rule drafts, that is what you will find on that Rules and Laws BHA webpage or the other Secretary of State link that Mel posted earlier. And I also see a request for my contact information, which I'm happy to put in the chat.
Okay, question just came in through the Q&A. I was told by our leadership that we can renew our current BHE license through CDPHE for the next year since it expires in May. I just want to verify that this is the case.
Thank you for that question. So as I mentioned, until we have these rules effective, the BHA does not have authority to grant the BHE license. So until that point in time, when we receive that authority, right now we're anticipating October 1st, all renewals of current BHEs will be through CDPHE, as they are the only state agency that at this time has the authority to grant that license.
Okay, great. I'm also going to quickly move our spotlights over. So there's a question that isn't necessarily related to rule. So I'm not sure, Megan, if you'd like to hold that or if we have a little bit of time. It's a BOSO related question that came through the Q&A.
Sorry, my screen just froze for a minute. I couldn't get you all back. Angelina, can you say that one more time?
Yeah, there's a BOSO related question. And so for folks who, I put a link in the chat to our BOSO FAQ, which is Behavioral Health Administrative Service Organizations. It's a long acronym. And the FAQ is frequently asked questions. So there's a link in the chat to that. But we had a BOSO question come up in the Q&A.
Yeah.
Okay.
Morgan
All right.
Metlock again, BHA Commissioner. I can help. I also want to see if Stephen Pang is on the line. We have a massive timeline we're working together to execute for the people of Colorado. Stephen, I know we are bound by procurement rules, but maybe at a high level, we can quell some anxiety and kind of shares at a very high level how people will be able to respond. You've already highlighted that mid-May will be the release of the invitation to negotiate. We anticipate that the scoring rubric will be public. The people of Colorado will be able to see how we're scoring applications that will all be in the invitation to negotiate. The process of thinking through an equity questionnaire, a values commitment, all of those things will be part of that process. Stephen, say a little bit more at a high level about any other matters that would be helpful for those in our town hall today, if you're still on the line. And if not, I can.
No, I'm still on the
okay.
line.
Thanks,
So
Stephen.
yeah, I think there are some things like Dr. Medlock, you mentioned, we can't really share just because of procurement rules, but from the ITN perspective in terms of process, it functions very similarly to other procurements. So we'll release, and like we mentioned, we're trying to make it as comprehensive as possible so that everyone from the release of the procurement has as much information as possible to put together a proposal and as much information that we have and that we want to share. But then there will be opportunities, just like our other procurements, to a formal question and answer piece as well. So if there are things that are unclear and there are things that need to be clarified, or there are questions that come from the information that we are putting out in the invitation to negotiate, there will be a formal process to collect those questions as well as provide formal answers back on that question. And then I think, Megan, I did miss some of the question, so I may not be answering it completely. I'm sorry, I got a little bit distracted.
I think you got most of it. Let me go back to it.
And Stephen, maybe the folks on the line would be most interested in that. I think they've experienced our approach to doing pre-bidders conferences for other types of releases, and I think our plan is to do the same in this case.
Correct. Yep. So for the most part, like I mentioned, everything will follow our typical procurement processes. So we'll have a pre-bidders conference.
Thank you, Stephen and Dr. Medlock. I am not finding the question in chat.
Megan, it was in the Q&A.
Okay.
Of which we don't have any additional open questions right now. And Kevin, thank you so much for putting in the chat. The proposed rule is 1,168 pages long. So obviously we appreciate your intention of calling that out and the likelihood that someone would read through that entire thing. So Victoria, we appreciate. Victoria put a link in the chat. I'm going to let you just talk a little bit more about how you're trying to make it into manageable chapters.
Yes, absolutely. So we understand that this is a very large package of rules. And the reason for that is that we, and Mel alluded to this, that we are trying to streamline and get all of these different licensing pieces that live here and here and here and all into one place. So that's the reason that it's so long, if that's helpful at all. And what we hope to do is get the most updated rule language. So the rule language on that webpage right now is a couple months outdated at this point. We've now since taken stakeholder feedback and made changes. Those changes have been incorporated into these official Secretary of State documents, and we are working on taking those apart so that you can go to that webpage and you'll see a drop down that says Chapter 1. You'll be able to click Chapter 1 and then just see that Chapter 1 language as in its most recent form. So just wanted to let you know that that is very much in the works. If you're really excited to take a look at this new rule language, you can go ahead and take a look at that larger packet. As I think Dr. Medlock noted in the chat, a number of those pages are technical rulemaking pieces where we had to put old rule language on one side of a table and new rule language on another side of a table. And so that takes up, I think that was maybe like 600 to 800 pages. We also have a number of, a couple hundred pages of our public comments that we received in our response to those comments. So you scroll all the way down to get to the actual rule language. And I think that Rachel also noted that we have person first summaries on that webpage. So essentially we took each chapter of rule and wrote in plain language, what is this chapter about? What is in this chapter? What can I expect? So that in plain language, so kind of breaking through that technical rule language that we sometimes have to use and really just explaining what that means.
Thank you. So I know we're at 3:52, but I think we have a little bit of time just to follow up to that question, Victoria. Are those the chapters that are posted on the BHA website?
Yes, so there is a little bit of nuance here. So the BHA website has our full rule volume. So chapters 1 through 22 that we are proposing. As was brought up a couple of times, we are currently in the process of promulgating rules related to behavioral health entities. So that's chapters 1, 2, and 5 through 16. The other chapters are going to be promulgated later. I know chapter 17, the 2765 chapter, has been a topic of interest today. So what you will see on this website are our full list of chapters of proposed rule. What has gone forward and what is on the Secretary of State's website is those chapters about the behavioral health entity license. So chapters 1, 2, 5 through 16.
Thank you so much. And then I'm gonna ask Dr. Medlock, I saw you just came off camera. So I'm gonna throw this question in the Q&A out there because we did open it up for questions. And I know this one has been going around a lot. So when will the BHA announce who is being awarded the first round of ARPA grants?
You want me to answer that?
Well, I'm not necessarily, but I saw you come off camera. So I thought maybe you were preemptively turning your camera on to answer.
Oh yeah, I no worries. Yeah, so Stephen, I think we actually have a big update on this, our Continuum of Care grant. I think the people of Colorado have actually exhausted that pot of money. So for those who are following the numbers, we're referring to the 1281 pot of money for the Continuum of Care grant program. We still have a small bit of money, I believe $2 million left for children, youth, and families, but we know we have great needs across our continuum, and I believe those continuum grants are exhausted. But Stephen, let's give an update on what's left. I think we still have workforce dollars left, but let's share a bit about that. And while you do that, I'm going to paste in the funding page so that folks who don't know how to apply for the remaining funds can do so. So over to you, Stephen.
Yep. Yeah. As Dr. Medlock mentioned, we are making a lot of progress on this. I think the exact question is, when will we announce the awards? I think at this point we've announced that we believe we've exhausted all the funding, but we have not yet actually issued notices of awards to people. And that's for some due diligence reasons that we're doing to just double check that we aren't making any duplicate awards across the grant opportunities that we have, and or any duplicate awards across the other grant opportunities that other state agencies have. So there's just a lot of double checking we need to do with this, with how much funding we are issuing all at once here across the state. And so with that being said, we are really close. I think we're aiming for the next, I want to say, hopefully for those awards, the first rounds in the next 2 or 3 weeks, we can start issuing the notices of awards and letting vendors know whether, or providers know whether they've been awarded or not.
Thank you so much for those answers, Dr. Medlock and Stephen. I'm going to go back to sharing my screen, and hopefully you'll still be able to see the interpreter, but I can stop sharing if that's not the case. Okay, can someone tell me if you can't see the interpreter?
I think we are okay because I have spotlighted them, but for our folks who are done talking, if it's okay, if you can turn off your video, then they definitely will be visible by other folks. And then Megan, you probably want to hit your slideshow button again so we can see the big version.
Okay, so our next town hall will be Wednesday, April 26th from 3 to 4 p.m. And we will plan to follow up on questions that you all had from today, and as well as provide additional information on the behavioral health ecosystem and the continuum of care, as well as an update on care coordination. So now I would like, if you all could put into the chat any additional topics you would like to see highlighted in future town halls. And then I'll also change my screen to, you can scan here to stay connected with the BHA.
I'm going to note for our panelists who might still be on, there is a question in the Q&A about who Jen can connect to if they have additional questions about funding opportunities. So if whoever the appropriate contact person is could type their answer and provide their contact information to Jen, that would be great. And I see folks are putting things in the chat. Thank you so much. We're going to keep note of all of the topic suggestions as we start to build out future monthly town halls.
All right, we'll leave the chat open for another minute. But I just wanted to thank all of you for being here with us today, and thank all of our panelists for the great information, presentations, and answers to so many questions today. So I wish you all well.